Abbasi, and thank you for this opportunity. I am presenting on behalf of my team, Adu Mohiuddin, Ibrahim Al-Qadasi, and Travis Yamanaka. And there is a wide array of interstitial lung diseases with many disorders that fall under this category, and respiratory bronchiolitis, interstitial lung disease, is one of them that is related to smoking and heavy tobacco use. Respiratory bronchiolitis is a asymptomatic pathological lesion that is found in the lungs of cigarette smokers. Respiratory bronchiolitis, interstitial lung disease is RB with interstitial lung disease, basically lesion with signs and symptoms of ILD. The extent of the fibrosis in the walls of the alveoli can be used to distinguish RB from RBILD. However, RBILD is much less common than RB. The exact pathogenesis of RBILD is still unknown, although almost all patients with RBILD are current or former cigarette smokers, which suggests a key etiological role of cigarette smoking. Patients typically present in their 30s or 50s with subacute symptoms of dyspnea around 94%, wheezing around 69%, and cough in 66% of patients, with sputum production in only 50%. Hemoptysis is much less common than this. Virtually all patients with RBLD are current or former cigarette smokers that have greater than 30 pack year history. Rarely patients have been reported to have substantial passive cigarette smoking exposure or heavy use of electronic cigarettes such as vaping. However, no reported cases have been reported for marijuana use. Our patient was a 29-year-old man who presented with an episode of severe hemoptysis and dyspnea. The patient's past medical history was relevant for only 18 pack year history of smoking. However, heavy marijuana use 3 to 4 times a day for the past 15 years. The patient on presentation was alert and oriented, however, distress and mild distress due to shortness of breath. On physical examination, the patient was unremarkable except for diffuse expiratory wheezes and diffuse expiratory crackles bilaterally on chest on the right lung greater than the left. Urine toxicology was also positive for cannabis metabolites, and the rest of the blood work was non-significant. He had a very similar episode 1 year ago, and extensive workup at that time, including bronchoscopy, was negative, except for the CT scan at that time was very similar to this CT scan. The patient's CT scan this time was positive for diffuse right lung and left upper lobe ground glass opacities with bronchial wall thickening. The patient did not follow up after that presentation. The patient presented again this time with similar presentation and was more compliant and follow-up helped us exclude other interstitial and mixed connective tissue disorders. Tests that were ordered included, but not limited to, anti-glomerular basement membrane antibodies, ANCA, ANA, antiphospholipid antibodies, RF, and CCP antibodies, and alpha-1 antitrypsins. These were all negative. The patient at this time was diagnosed with RBILD and was started on supportive therapy. And the patient was also told to follow up for pulmonary rehabilitation, quit smoking, and to stop the use of tobacco and marijuana. Marijuana is emerging as one of the key players in a wide array of lung diseases. And in the past 20 years, the marijuana use has risen. Many patients present with some respiratory symptoms after recent use. Marijuana is emerging as one of the key players in lung diseases that are not limited to silica-induced pneumoconiosis, acute hypersensitivity pneumonitis, and diseases such as those. RBILD is more often diagnosed in patients if they fulfill a set of clinical criteria, which this patient does not meet all of them. However, this patient does meet some. The patient, he only had an 18 pack year history of smoking. He did not have most of the common symptoms and recorded a heavier use of marijuana compared to tobacco use. He also did not meet any criteria for the other ILDs. There needs to be more studies determining the respiratory effects of marijuana and moving forward, in addition to counseling patients with similar presentation to stop smoking and to